Hi there. If you're watching this, you're probably looking for some really clear, solid information on a topic that can feel pretty overwhelming. So today, we're going to demystify amniocentesis. My goal here is simple: to give you a straightforward guide so you can feel clear and a lot more confident about whatever comes next.
So, what happens when those initial tests don't give you the whole picture? Maybe you've just gotten screening results that came back flagged as high risk, or an ultrasound showed something that wasn't expected. It's a moment that's just filled with questions, right? And it is completely normal to feel like you need more information to figure out the path forward. In this part of the journey, it's not just about dealing with uncertainty, it's about finding clarity. It's about getting to a place where you can make informed, confident decisions that feel right for you and for your family. Okay, so let's start right at the beginning. Why would you or your doctor even begin to consider a diagnostic test like amniocentesis? What leads to that conversation? Well, there are several really clear reasons why this test might come up. It could be that a screening test like the NIPT, that's the non-invasive prenatal test, came back showing a high risk. Or sometimes an ultrasound might spot a potential structural issue. In other cases, there might be a known genetic condition that runs in the family. It's also an option for women over 35 who want definitive answers, or simply if earlier tests just didn't give a clear result.
And this right here, this is probably the most important thing to remember. The decision to go ahead with a diagnostic test is always yours. The whole point of good medical care isn't to push you one way or the other, but to arm you with all the information and support you need to make your own choice. Okay, so we've covered why someone might consider it, but let's get down to the basics. What exactly is an amniocentesis? Let's break it down. At its heart, it's what's called a diagnostic procedure. This means it's designed to give a definite answer. It works by taking a very small sample of the amniotic fluid that surrounds the baby. Now that fluid is amazing. It contains the baby's cells, and inside those cells is the complete genetic blueprint, so we can analyze it directly.
And this is a really important difference to get your head around. Screening tests, which you may have already had, they just estimate the risk, the chance of a condition. They can't give you a solid yes or no. But a diagnostic test, like an amnio, it's designed to do exactly that, provide a clear diagnosis.
There's also a pretty specific window when this test is usually done. Typically, it's performed somewhere between the 15th and 20th week of pregnancy. That's the time frame when it's considered to be safest and to provide the most accurate information.
So what kind of information can we actually get from that little sample of fluid? Well, the analysis can detect major chromosomal conditions like Down syndrome, but it can also go deeper using tests like karyotyping to look at the big picture of the chromosomes, or something called a microarray to spot tiny, specific genetic changes. It can even be used to check for specific inherited conditions if you have a family history of something.
All right, we've covered the what and the why, but let's be honest. The biggest question for most people is about the procedure itself. What actually happens? Let's walk through exactly what you can expect on the day. The whole thing is a really clear 5-step journey. It always starts with counseling, which gives you the space to get every single one of your questions answered. Then, the procedure itself is guided by ultrasound every second for precision and safety. The actual sample collection is super quick. After that, the sample goes off to the lab, and the final step is when you sit down with your provider to discuss the results and what comes next.
Okay, let's just get right to it. This is probably the #1 question on your mind, and it's a totally fair question. What does it actually feel like?
Well, the feedback from specialists who do this all the time is pretty consistent. Most women describe the feeling as discomfort rather than actual pain. A lot of people compare it to getting your blood drawn or maybe a mild period cramp. It's this brief moment of pressure that passes really quickly. And of course, right behind does it hurt is the other huge question: is it safe? Anytime you're talking about a procedure during pregnancy, you want to know about the risks.
And the data on this is, well, it's incredibly reassuring. The key is that when the procedure is done by an experienced specialist who is using that continuous ultrasound guidance, the risk of any serious complications is less than 1%. So, once the procedure is over, the focus totally shifts, right? Now it's all about waiting for and then making sense of the results.
That waiting period can feel like the toughest part, for sure. So having a clear timeline really helps. Generally, you can expect to get your results back within 1 to 2 weeks, and your clinic will of course keep you in the loop.
Now, when the lab gets that sample, they have a couple of different tools they can use. You can think of it like this. Traditional karyotyping is like looking at a full set of encyclopedias to make sure all the books are there. A more advanced test, the CGH array, is like opening up each book to make sure no pages or even single sentences are missing or copied.
And that brings us to what might be the most important part of this whole conversation. Because getting answers is one thing, but feeling supported through the process, that's everything.
So what does comprehensive support even mean? Well, it means you're looked after at every single stage. It starts with having experts who perform the procedure gently and with incredible precision. It includes that deep counseling so you feel really confident in your decision. And most importantly, it means you have a compassionate team to explain the results clearly, no matter the outcome, and to guide you through whatever steps come next.
Because at the end of the day, this isn't just about delivering a lab report. It's about providing real, human support for a deeply human experience. It's about answering every question with empathy and with expertise.
So, as we wrap this up, I'll just leave you with this question to think about. In a journey that's so personal, one that requires so much clarity, what does true support really look like for you? Because knowing that will empower you to find the care that you need and that you absolutely deserve. Thanks so much for joining me.